Prior to 1895, it was impossible to see past the physical barriers of our world. Revolutionary X-ray technology allowed us to observe matter beyond these boundaries. This radical advancement brought global change in scientific fields and surgical practice. It was November 8, 1895. Physicist Wilhelm Conrad Röntgen was a professor at the University of Würzburg. Röntgen had been studying cathode rays in a Crookes vacuum tube, which is a glass bulb evacuated of air filled with gas and positive and negative electrodes. When a high voltage current was passed through, it would put off a glow. While experimenting, he noticed that a photographic plate in the lab would begin to fluoresce each time he turned on the electron beam. While he knew that fluorescent material ordinarily glows when struck by radiation, the tube was surrounded by heavy black cardboard, and the photographic plate was 9 feet away. This was unexpected, as normal ultraviolet and sunlight rays couldn't pass through. Initially, he wrote this off as the result of invisible rays coming from the tube. However, further exploration led him to believe there was something more.
Using the cathodes, he can see some fluorescence on a cardboard, and he said, okay, something means that something there that we cannot see. He couldn't say what it was, and they call it X because it was an incognito.
Before sharing his results with others, however, he wanted to make certain that this fluorescent outcome would be consistent. His experimentation went on for several weeks. He would place different materials that would block visible light between the tube and plate. Each time, the plate fluoresced when he turned on the beam. Eventually, he placed his own hand between the tube and plate to find to his amazement that he was able to see through to the outline of his bones. One of his most iconic photos was of his wife's hand wearing her wedding ring. Through continued study, Röntgen was able to further define X-rays as a type of electromagnetic energy wave, which acts very similar to other kinds of radiation, aside from wavelength. X-ray wavelengths are 1,000 times shorter than that of visible light, which explains their immense energy and ability to pass through most substances. Less than 2 months later, on December 28, 1895, he submitted his first paper on a new kind of ray, a preliminary communication, to the Würzburg Physiomedical Society, as well as sending copies to friends around the world. In 1896, he made his first public presentation before the same society. The X-ray was deemed a medical miracle. For the first time in history, doctors didn't have to rely on external observation and their best guess at a patient's condition. Abnormalities such as broken bones, bullets, and tumors were able to be easily localized inside a person's body.
X-ray, we have a certain device that can, for the X-rays, constant flow of X-rays, and you can see on a monitor what is in the body, exactly the moment it's shooting the X-rays, and then the doctor can put the syringe and the needle inside the spinal cord and look exactly where it is. Then he can know if it is go too close or is exactly the spot that he needs to put the injection.
Soon after, Röntgen received countless scientific awards and high praise. In 1901, he became the first person to ever receive a Nobel Prize in physics. The hype following this newfound technology was overwhelming. As a service to the scientific community, Röntgen refrained from patenting his work on X-rays to allow scientists worldwide to improve upon his discovery. Within 1 year, over 1,000 scientific articles were published in relation to X-ray experimentation. Thomas Edison was one of the first to begin exploring the application of this technology, attempting to use X-rays to view real-time moving pictures of the inside of matter, called fluoroscopy. By the early 1900s, he had created a fluoroscope apt enough to be suitable for commercial use. The immediate response of the public following the newfound X-ray technology was phenomenal. The reaction, a sudden outpour of X-ray commercialism. From golf balls to stove polish to headache pills, Products worldwide professed similarities to this new light. Professional photographers were among the first to explore X-rays creatively, fulfilling society's need to look at what's on the inside and creating a new form of art, Röntgen photography. At first, in the early 1900s, physicians would send their patients to independent owners of X-ray equipment, but by 1910, most physicians had recognized the advantages to owning their own. However, due to difficulty deviating their time, the day-to-day operation and maintenance of X-ray machinery was designated to office assistants, secretaries, and nurses.
It's very useful for us clinically because it passes through the organs and it can go to a plate. We can see what is there, what is absorbed, what is actually passing through there. It's like a photograph, but in different intensity because it's ionizing radiation.
It wasn't until after many casualties that the harmful effects of this kind of radiation were realized. Initially, it was believed that X-rays passed through our skin just as harmlessly as the visible kind. However, it soon became apparent that excessive exposure led to severe burns and skin damage. Many of the office assistants and nurses developed cancer after repeated exposure to X-rays. In 1904, Thomas Edison's assistant, Clarence Daly, who had worked closely with X-rays for extended periods of time, passed away from skin cancer. After this incident, Edison abandoned working with radiation altogether. Arthur Mutschler, in 1924, was the first to recommend a tolerance dose of 70 rem per year, which he declared to be adequate and livable. Over the years, the suggested amount of radiation exposure has continued to lower, as radiation safety increases. The development of radiation dosimeters and Geiger counters have also aided in protection against X-rays by allowing radiation workers to measure their exposure.
So, for example, we use an apron that is made of lead. Lead is a very good protector because it absorbs X-rays.
The X-ray has paved the way for many innovations of today. What started as a simple radiograph of his wife's hand evolved into sophisticated machinery. Whereas Röntgen had used X-rays to look internally, other fields expanded X-ray technology to study the macro of the universe. In 1999, the Chandra X-ray Observatory launched into orbit just above our atmosphere as a telescope specially designed to take radiographs of places we can't see, according to NASA. Through X-rays, we are capable of learning more about objects that would have been impossible to see with the naked eye. The X-ray has developed industrial uses by allowing factories and businesses to scan for defects in products externally. Using this same technology, we use X-rays to scan for weaponry, hazardous substances, and drugs in security all over the world. The medical field continues to be the most significant area transformed by X-ray technology. Real-time imaging has allowed us to diagnose medical issues through the ingesting of radioactive material and track it using X-rays in motion. We are able to see inside of even the most hard-to-reach places, like our intestines and other organs.
We can see the bones, we can see some of the tissues also that are soft tissue. For example, if there is a kidney stones or some kind of blockage. If a kid swallows something, we can see it there.
The X-ray, discovered in 1895 by Wilhelm Röntgen, has paved the way for many invaluable innovations of the modern world. His accidental exploration of new light has become one of the most critical discoveries of today, providing new opportunity to observe the unseen world within us and around us.